So when you look at the literature around evidence implementation, it's actually defined by Jill Harvey and Alison Kitson as anything that makes it easy for others. So it's both a role and a process. So if it's a process, it's facilitation. If it's a role, it's facilitator. But people tend to use different terminologies to refer to that role. So Maureen earlier spoke about knowledge brokers, and then you could see all other terms that have been associated with facilitation. In fact, Lisa Cronley and her colleagues back in 2017, they did a scoping review to identify all the roles that have facilitation strategies in them, and you can see all of those terms in the slide. No, it doesn't really matter what term you use, as long as you make it easy for others. But at JPI, we specifically call it facilitation or facilitators. When you look at the literature around facilitation, you would know that there's quantitative evidence around its effectiveness. So we know that facilitation is an effective strategy for evidence implementation, particularly in primary care and chronic disease management. Where it's lacking, though, is the qualitative exploration of facilitation as an evidence implementation strategy. You will find a lot of primary studies around the experiences of those who have provided facilitation and who have received facilitation, but they have not been collectively examined. And in order to optimize the outcomes of facilitation, you need a more comprehensive understanding of how facilitation works and the nuanced experiences of those people who actually provide facilitation and those who receive it. And that's what we did. So we identified specific questions. So we focused on those gaps. So we have a lot of things to do still around facilitation. There's still a lot of unknowns, but we focused on the exploration of the experiences of individuals who provide facilitation. Now, the reason we actually did that systematic review, the primary motivation for us was we want to optimize the outcomes of facilitation, and we also want to set them up for success. So what we found was that health organizations who wish to undertake evidence implementation initiatives, they have to carefully select their team of facilitators. Obviously, it can't be a one person. It has to be a team of facilitators, and that can include internal or even external facilitators. And for those who are internal to the health organization in which the evidence implementation initiative is going to happen, they have to be provided with protective time, especially if the facilitation role is an add-on to their clinical role or other roles within their organization. It would also be good if they could actively, health organizations, to consider actively seeking individuals who have those qualities and traits that I have reported earlier and those skill set, so that they can actually build a workforce capable of providing facilitation. They should also, someone said about modeling earlier, so executives as well as managers should model facilitation practices, and they should promote a culture that celebrates and rewards facilitators. And for individuals who are taking on this role as a facilitator, they should be very self-reflective, knowing what they bring to the table, what skills they have, what traits and personal characteristics they possess, but at the same time also identify opportunities for them to learn. And then the novice facilitators, obviously you will have a combination of probably novice and more experienced one, they would benefit from more experienced facilitators and even undertaking professional development and training.